My name is Dr. Frederick Covington, and I'm an occupational therapist. Today, we'll be discussing early intervention. Now, early intervention are procedures and programs that facilitate the development or skill acquisition in infants and young children who have disabilities or those who are at risk for developing disabilities. It includes programs that are designed to prevent handicapping conditions in infants and young children, and family-centered programs designed to affect the functioning of infants and children with special needs. Now, with all that said, let's take a moment and break this down. The learning of basic and brand new skills that typically develop during the first years of life is the focus of early intervention. With this in mind, we see how early intervention can play an integral part in the early developmental stages of life. In addition, early intervention helps those in need meet particular age-appropriate developmental milestones. Areas of early intervention include physical developmental milestones, which would be reaching, rolling, crawling, and walking. Cognitive developmental milestones, which would include thinking, learning, and problem solving. There's also communication developmental milestones, which would include talking, listening, and understanding. There's social emotional developmental milestones, which would be playing, feeling secure, and feeling happy. And there's self-help developmental milestones, which would be eating and dressing. Now, let's look at some real-world examples. And we will begin with a scenario which I like to call Once Upon a Time. Now, you may be sitting with a puzzled look on your face now, but let me explain. Let's look at students A, B, and C. Student A is a 15-year-old student whose teacher is ready to fail him because of his poor handwriting. Now, once upon a time, when the same student was 4, he was unable to keep his alphabet aligned on his wide-ruled paper, nor was he able to complete simple mazes. His visual motor integrational skills were not addressed when he was young and is now a hindrance to his progress. Now, student B is a 14-year-old girl who is extremely aggressive in school toward her peers. Moreover, she often gets into fights and altercation and appears to simply hate being around people. Once upon a time, she was a 5-year-old little girl that would cry when having to do finger paints, have a tantrum when asked to play with modeling clay, and always complain about the tags in her shirts and how her clothes didn't feel right. Her hypersensitivity/tactile defensive tendencies were not addressed when she was young and is now a hindrance to her progress. And lastly, let's look at student C. Now, student C is a 13-year-old student whose reading comprehension has been the topic of discussion at many parent-teacher conferences. The teacher states to the parents that he is an extremely bright child and can answer any question from a discussion in class. However, can never fully explain or discuss a reading assignment. Now, once upon a time, when the student was 7 and had to read aloud in class, he would often repeat words multiple times. He would read a sentence, and before starting the new sentence, he would reread the last couple of words in the previous sentence. He was also extremely poor at sports and refused to play on a majority of occasions. His visual tracking skills were not addressed when he was young and is now a hindrance to his progress. Now, in all of these instances, if there would have been early intervention, these issues, problems, and hindrances that we see in these children could possibly be greatly decreased or even non-existent. Now, looking at symptoms or reasons to be concerned, we must always be mindful that every child is different and progresses in an individual manner. However, there are base performance components that they should meet at certain ages and stages in life. Having an individual proceed through life without successfully achieving base developmental milestones is just a recipe for academic failure and scholastic latency, and possibly general difficulties throughout his or her life. We must begin to look at children the same way an architect looks at building a home. If the architect has $1 million to build a home, he would not only spend $1,000 to plant or lay the foundation. If so, everything that he builds on top of that faulty foundation is bound to fall. Early intervention allows for that steady foundation to be laid. This allows us as educators, therapists, and caregivers to later build upon that foundation and have assurance that progress can and will continue. I believe it's paramount that each and every individual involved in the rearing and the growth of a child be keenly aware of developmental milestones. Not only would this allow for a dramatic decrease in academic and scholastic difficulties, but improve the overall quality of life for each child affected. As I've worked throughout the years seeing my patients and clients, I've encountered literally hundreds of instances where I could place the circumstances in the once upon a time category. So, in true occupational therapy fashion, I decided to do something about it. That something is a free app called IoT Screener. What this app does is allow a parent, education professional, caregiver, etc. to complete a developmental screen by assessing developmental milestones or assess observed behaviors in school-aged children. Now afterward, the app provides a detailed summation and what areas, if any, may be areas of concern. Now if you would, please take a moment to view the following short video giving you a brief description of the app. Thank you for taking your time and watching the video. And it's my sincere hope that this app can hinder some of the difficulties that we may see at home or at school by giving people the knowledge they need to seek the appropriate help for their little ones. The app should be available for both iOS devices and Android devices, hopefully around August. If you have any questions or comments, please feel free to send emails or leave your comments here. Or you can download the Ask the OT app for iPhone, iPad, Android, and Windows mobile phones and devices at askdrcovington.com and submit your question directly through the app. You can also contact me through Facebook, Google+, LinkedIn, and Twitter. Now, as always, I look forward to your continued questions, and we'll be seeing you next time. Take care.